So on to part 3 for our psychological therapies notes. We've done psychoanalysis through behavioral on the chart, and now we're moving on to cognitive. And just want to remind you about cognitive, one of the buzzwords being thinking. When you think cognitive, think thinking. So where do they see the root of psychological problems coming from is their irrational thinking, the wrong thought process. So under the aims column, you want to put essentially this paragraph here to some extent, that you teach people new, more adaptive ways of thinking and acting by ridding the person of false thoughts, by helping them to understand, as it says on the slide here, that thoughts intervene between events and our reactions to them. So as it shows you kind of in the diagram here, if someone loses their job, they could very much have the internal belief that they're worthless or hopeless, and that leads to their reaction of depression. So a cognitive therapist would help them see a loss of a job and almost rationalizing or thinking about it differently, like, well, my boss was a jerk, or I deserve a better job. And that then leads to less depression, if any at all. So in the methods used column, we've got rational emotive therapy and cognitive behavioral. But I want to talk first about how cognitive therapy is very applicable to depression. You might want to do this in some blank space somewhere, loose leaf or in the margins. That Aaron Beck is huge here. In fact, you want to write his name and Albert Ellis, E-L-L-I-S. Those are huge names to tie with cognitive therapy. But Beck was the guy who did a lot of research with cognitive therapy and depression, suggesting that depressed patients believe they can never be happy. That's their irrational thinking, and thus associate minor failures, for instance, failing a test, that event, in life as a major cause for their depression. So even the smallest thing can trigger it simply because of their irrational thinking. So you've got to change that thought process. So in some studies, they trained depressed patients to take recordings every day of positive events and relate how they contributed to those events, seeing that they had control over positive things happening in their life. And compared to other depressed patients who didn't do this, the trained patients showed lower depression scores. So this chart kind of showing the effects here in that the cognitively trained patients going through cognitive therapy very much lowered their depression rates. So back to the chart under methods used, one being cognitive behavioral, and it very much ties two perspectives together, but we'll talk about this one first. So cognitive therapists combine the reversal of self-defeating thinking, that's the cognitive part, but with efforts to modify the behavior, hence the behavioral part. So this therapy aims to alter the way people act, but also the way that they think, okay? Now, rational emotive therapy is on like an ABC model. This is all in the chart for you, and you can read straight from it, where they have the negative activating system, which leads to the irrational belief system and then the emotional consequences. So what they want to do is eliminate the maladaptive cognition or thinking and adopt more effective thinking. That's really kind of the basic cognitive therapy. And then the cognitive behavioral adds in some kind of self-reinforcement, as it says there for you on the chart. You should also write the acronym REBT next to cognitive behavior therapy. This is rational emotive behavior therapy. This is huge in the role of the therapist. It helps individuals see their false ways of thinking. Rational emotive therapy does so in a very direct and confrontational way. I would highlight that, and that rational emotive therapy and really cognitive therapy in general is the most controversial, because that's kind of the aim of the therapist, is to essentially get in someone's face and saying, that's a dumb thought. Why would you ever think that? This is what you should be thinking, so let's fix it. So they almost, in the confrontation of the therapy, are being therapeutic for their patients. Really quickly, let's sum it up with the family and group. So you treat the family or group as a whole to overcome the problems. It normally consists of 6 to 9 people, 90-minute sessions. The group contains a group of individuals with all the same problems, so you discuss as a whole. You might want to put that we watched the VH1 OCD the OCD project, that was group therapy. And they very much benefited from knowing that others have similar problems. And then family therapy, where you treat the family as a system to resolve the problem, setting kind of a scaffold in place and heal the relationships and improve communications.